back with the Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes. And in our medical segment, we are so excited to have with us Dr. Sanjay Juneja and Dr. Lauren Juneja. And you did notice they have the same last name. And so we're excited to have both of y'all. You're at Marybird Perkins Cancer Center and are both medical oncologists.
Yes, ma'am.
Yeah, I know that my husband and I are both OBGYN. We mentioned that. And everybody was like, so did y'all meet during your training? Because otherwise you probably wouldn't pick somebody in the same specialty.
That's right.
It's certainly not with OBGYN.
Yeah, that's
Right.
true. That's true.
So with all that call and stuff way back then. But anyway, so January is Cervical Cancer Awareness Month, something I know a little bit about.
Yes.
Thank goodness we usually pick those up as precancerous
That's
lesions
right.
before we have to send them off to you guys.
That's
but
right.
let's talk a little bit about what is cervical cancer, because sometimes even, people are like, which part of me is that? What is that? And we'll talk about that first, and then a little bit about what are some of the symptoms.
Right. So cervical cancer is a cancer that starts, of course, on the cervix, and the cervix is basically the opening or the bottom part of the uterus.
Right, the part that dilates when the baby comes out.
That's right. And so cervical cancer develops usually over some time, and if patients are good in seeing their OB-GYN, like you said, usually it's picked up as a precancer.
Right.
The important thing about cervical cancer is, of course, following with your gynecologist, getting your pap smears, but then now, of course, is getting your HPV vaccine.
Yes, and we've known for a really long time that cervical cancers are related to HPV. And as we talk about vaccines, it's been out for a while.
Right.
Very safe. It first was just recommended for young girls, and now is also recommended for boys as well. And initially, a lot of women were like, well, my daughter's not sexually active. I don't think she needs to get it. Well, you're supposed to get it before that happens.
That's right.
That's where you get the prevention.
Exactly.
So it's just kind of like a lot of the other vaccines, like with hepatitis and stuff. It's a newborn vaccine. We're trying to get rid of that.
Right, exactly.
So,
you have to get the vaccine before you become sexually active because HPV is so common. As you know, it's the most common sexually transmitted disease that you can get. And so by the time, adolescents or, even in their 20s start having sex, that's when you're going to pick up that virus.
Right. And there's so many different strains, and it has no symptoms. So a lot of times no one knows until they come in and they have that abnormal pap smear, which then could be precancerous and hopefully not cancer. Let's talk a little bit about symptoms, because I think, a lot of times there are no symptoms until it's
advanced.
advanced.
And a lot of people
Yes.
are behind on their annuals because of COVID.
Right.
And so now would be a time to encourage a woman that you love, anyone of any age that's female, to go get checked.
That's right. And I think a lot of times what happens too is we're so, younger patients, of course, they're on birth control or they're, getting pregnant, and they're good about seeing the gynecologist. But as you know, sometimes as women get a little older, they think, I don't need to see the gynecologist anymore. Mm-hmm. And really, too, that's the time to see, because a lot of times, if you've had HPV for a while, that's when it really is turning into a cancer.
Absolutely. And so let's go over some of those symptoms, because sometimes women, they come up with reasons why they might be having some of those symptoms.
Exactly.
And certainly there's plenty of benign things that could cause a lot of the symptoms, but something to go look at. So one of that is irregular bleeding. Mm-hmm. You go ahead, run down that. We're going to let you speak. He likes to speak over there.
Appropriately, it's definitely, a female-dominant cancer, but the important thing is, symptoms, if you have symptoms, it's going to be, especially if you have bleeding after, you've stopped having your cycles, that's concerning, right? It's abnormal.
Absolutely. It is not because your granddaughter moved into the house and you started your period.
Right.
I've heard that before. I've heard everything crazy that people try to rationalize. But if you stopped having cycles, and you're an older woman, you should never bleed, and if so, you
Right.
guys check it out.
Exactly.
And even if it's something like, oh, well, you know, we just had intercourse and stuff, if that wasn't the norm and it is now, then that's something concerning, either for your,
Right.
you know, uterine or cervical pain, you know, bleeding. But the key is, and I just want to touch on the concept of screening. So I was at a wedding and somebody said, well, you know, I'm kind of traditional. If I have cancer, I don't want to know about it, right? But I just want to, you know, take the course as it comes. But what screening is identifying something before it becomes cancer.
100%.
That's the key. So our bodies are always like fighting, you know, cells that are normal cells that are trying to go rogue, and they kill them.
Yes.
So we've all cured cancers throughout our lifetimes.
Right.
And that's why we learned a lot with HIV before we could treat it. When the immune system was down, we learned so much about cancers and what comes out when we see the immune system is gone. But what you want to do is, before you get those multiple mutations, you want to see just a couple that look kind of funky and then say, this is not right. Let's just take out all of those. Let's just remove all the ones that got these mutations over years and years, 90% plus, which is HPV. You know, if somebody said, I could take out 90% of the causes of pancreatic cancer. Do you want this vaccine? I mean, we would be lining up, right? Pancreatic cancer is terrifying. That's what this offers. That's why they say it's preventable.
Absolutely, and I always told women, it's like nobody really should get cervical
Exactly.
cancer these days.
Right.
With the vaccine and getting appropriate screening, no one should come in and have advanced cervical cancer,
Right.
because even if they get mutations, it's going to be picked up precancerous, which can be
Exactly.
easily treated. So the whole thing is screening.
Because it's slow. You know, that's not always the case with mammograms. You can get it in a year's time and other things. But this one, it truly is, you know, a silver lining. It just takes a while. Like, you have to have a series over several years before you get there. So if you're listening and you're like, well, it's been about 5 or 6 years, there's a little anxiety. It's not a common cancer. Louisiana's
Right.
6th in the country of the highest cases. But overall, it's just very unlikely when you go, it'll be positive.
Right.
And that's why getting that peace of mind to go and say, oh, I got it tested and I'm good, that's a great feeling.
Absolutely.
And statistically,
That's right.
it's just unlikely you'll have something abnormal, so you should go and you can say, I'm good for 3 years, you know?
Yeah.
Yes.
And risk factors. We mentioned HPV, but a lot of women don't realize smoking. Yes, smoking. And if you have HPV and you smoke,
Yes.
just a catalyst.
Exactly. Make sure you're getting your pap smears, for sure.
And a lot of my patients, when they would have precancer cells, they say, what can I do so that this doesn't recur
Right.
and turn back and progress to cancer down the road? And if they were a smoker, it's like the biggest thing
Stop
you can do is quit
smoking.
smoking. And they cannot relate
And they'll say,
how
"What's the other
smoking
thing?"
has to do with cervical cancer, because they only think about it with lung cancer
Right.
and, mouth cancers,
Right.
but it's definitely connected.
Ooh,
And
mouth
there.
cancer. So yeah, head and neck. That's why men, one, we can transmit it, but head and neck cancer is not fun to treat. It's radiation in places that you really don't want to be dry, and they've gone way up because of HPV. But then now that people are getting the vaccines, we were at an age it came out after, so you can actually get it up to 45. If you're female and you're single and you hadn't gotten it before and you have multiple partners, you still want to get it in the chance that you don't have it because it's just so effective.
So why 45?
Absolutely.
Why is 45 kind of the cutoff? I'm just curious.
So the guidelines are definitely for women 11. Age 11 is when you can start to get the vaccine, and up until you're 21 or 26. But after that, if you're sexually active, the chance of you getting HPV, because HPV is so common, is pretty high. And so the vaccine is probably not as effective because you've already been exposed.
And that too, it just takes so many years that you really want to make sure you just took care of it beforehand. And somebody's probably thinking why does a virus cause cancer? So we know viruses cause cancer a lot, and this is going to be scary, but it's because they mess with your DNA of your normal cells. They get in there and say, I'm going to turn on an on switch and just kind of make it, again, I say sketchy, but it's true. That's what viruses do. And then if you could block that from happening, you don't have that kind of funky kind of characteristics on any cell. This is not just cervical, this is anything really.
But I really do love that you're so comfortable talking about it. And I think so many men are so uncomfortable talking about anything gynecological, anything that could affect a woman's health in such a serious way. They're just not comfortable talking about it. So it's so great to hear you talk about it so comfortably. And I hope that encourages a lot of you fellas
Right.
to ask questions and talk about it and find out, so you can help the women in your life that you love, your mom, your sister, your wife, your girlfriend, your lover, your younger daughter who needs to be cared for in the way that she's thinking about her health long term.
And we know the vaccine is safe. Get your vaccines. And then, like you said, all the women in your life, they need to see their gynecologist and get their pap smears.
You could literally save someone's life by just nudging them. You know, you're getting drinks one night or having dinner and be like, by the way, did you get my pap smear? I just got to ask. Like, 'cause you really could just you could change the entire course of their life. And
Get your mammogram while you're at it.
yeah.
right.
And if it's advanced, it's very difficult to treat. Like, that's the
Yes.
unfortunate thing. It's like, it's so preventable, but then it's not very forgiving when it is advanced.
Right. And, you know, we don't have very much time left. So we are 100% going to have you guys back because
Yes.
I really want to cover screening because that confuses a lot of women with all these new guidelines out there. So make sure that you're up to date on your pap smears, seeing your physician on an annual basis so you'll know if you're up to date. And where should folks go? Marybird?
Marybird.org is where you can get a lot of information, and the pavilion at Women's, you know, that they navigate everything for you. So it's a one-stop, you know, shop. You get your pap smear, you get referred to the surgeon, you have a navigator that coordinates things for you. We know how fragmented healthcare is, and you have appointments here and there, and nobody talks. At the pavilion, you get all of that at one place.
Yes.
And then you can also see us at Essen or in Baton Rouge General.
Yes. Well, thank y'all so much for joining us. We're going to have them back. Husband and wife duo, Dr. Juneja.
That's right.
And stay put because we got some music coming up next for you.
Thank you.
Thank you.